All right, perfect. Well, thanks so much. I think we're going to get started right now. My name is Andrew So. I'm the Executive Director of South Bronx United, and this is one of our bi-monthly community resource forums. Today is going to be focused on the current state of COVID-19 vaccines, especially vaccines for children and boosters. And we're really excited to have back with us today Dr. Daniel Kaplivsky, who's joined us last year for a session when the vaccines just started coming out for youth. Dr. Kaplivsky is a professor of infectious disease. You may need to correct the official title. We can go to the next screen. He's the director of infectious diseases at Mount Sinai Hospital, as well as the medical director of travel medicine, and a professor at the Icahn School of Medicine at Mount Sinai. Fortunately for him, he's also bilingual in Spanish, so he'll be able to address any questions that come up both in English or Spanish. But without further ado, I'd like to introduce Dr. Kaplivsky, and then we'll kind of talk through what the agenda for today will be.
Thanks so much. It's so great to be with you all. It's exciting to talk about vaccines in children. You know, I think it was a long time coming, and we're very excited that we're at this point where we have these vaccines available. So happy to talk about them. Podemos hablar en español también. Estoy muy feliz de estar con ustedes y cualquier pregunta, por favor, me pueden preguntar directamente o en el chat. Great. So I guess we'll just go through, some of the information that is available and it's on the CDC website, and that we have here on the screen. So I don't know, Andrew, do you want to walk through these points, or do you want me to go through a couple of these first?
Yeah, sure. I'll walk through the agenda, and then I'll turn over so you get your voice break. And what we'll do between each session, at the end of each section, we'll pause quickly in case there's any additional questions that are related to those specific topics. But if there's any broader topics, we'll be saving those for the Q&A at the end. So our agenda for today is to focus first on information about the COVID-19 vaccines for children, who's eligible, what ages, how it works, what concerns there may be, everything along those lines. So we'll talk through that and give everyone a chance to ask questions in that area. We'll transition a little bit over to boosters, which has got which is all over now. Both some children and adults are able to get their boosters, and hopefully many already have them. So Dr. Kaplivsky will go into detail on that. And then we'll go into a little bit around the future of COVID-19, what's coming up. There's a lot of thoughts around what's the future going to look like now. We've been living this with it for almost 2 years. So we'll touch on that. Then on the agenda, it says our COVID-19 protocol. What we're really talking about is what is the, just remind everyone, what are the guidelines at the state and city level around COVID-19? And we can certainly touch on for any parents in the program, what that means at South Bronx United, but we'll touch on the guidelines there. And then we'll touch on some additional resources, and then have a full open Q&A for everyone. So I think we can just jump right into the first section and let Dr. Kaplivsky take it away.
Okay, thank you so much. So I'll preface this by saying that I'm an adult infectious disease specialist. I mainly spend my time taking care of adults. I am currently on service for the hospital, taking care of people who have COVID and are hospitalized with it. And so I see a lot of people who end up not getting the vaccine, who end up in the hospital and really wish that they had gotten it. So I think that's the first message I wanted to deliver regarding the adults. The world of pediatrics is a very specialized one, and so it's a little bit outside my normal practice every day. But I've got 2 kids at home, one who's 5 and one who is 2.5. So I'm happy that we were able to get our son Alex his first dose soon after he turned 5. I'll say that he tolerated it very well. the other thing that I think a lot of people have been through recently is that there have been breakthrough infections with Omicron variant. So these variants are basically changes in the virus that make it stickier to our receptor cells. And while the vaccines are very effective at preventing hospitalization and death, we certainly have seen breakthrough infections with Omicron. I myself and the kids had Omicron, during this December peak that we went through in New York City. So despite the best efforts, to prevent getting it happened. So, I was fortunate that I had 3 doses by that point of the vaccine. I'd gotten the first couple in actually December of 2020, and then January 2021, and then a 3rd dose as a booster in October. So, my case was relatively mild. It was, headache and fatigue. It was, fortunately nothing more than that. And, was happy that I didn't infect anybody else around me. And, the kids and I all kind of got it around the same time. So, I think the vaccines that are available currently that you'll hear about are the Pfizer vaccine, the Moderna vaccine, and to a lesser extent, the Johnson & Johnson vaccine. The vaccine that's currently licensed for children 5 and above is the Pfizer vaccine. And for kids 5 to 12, there's a slight difference in dosing because they're smaller, so it's based on their body weight. But essentially, it's the same idea behind the vaccine. It's a vaccine that uses something called mRNA, and our body makes proteins from that mRNA. And because our muscle cells are containing some of that spike protein of the virus, we develop some antibodies. And those antibodies are very protective for preventing hospitalization and death. And I think that those are the most important, key points about this vaccine. It's in terms of what its appeal is. So in terms of these bullet points, I'll just go through some of those as well, so we can chat through the details. The COVID vaccine is safe and effective, and it helps protect eligible children and adolescents 5 to 17. They're studying younger kids, 4 years old and younger. Fortunately, most of the disease that happens in younger children tends to be mild, but it's still a priority because those children can pass the infection on to their adult caregivers, and some of those may have immunocompromising conditions and might be more susceptible to more severe disease. The vaccine has been shown to be nearly 91% effective in preventing COVID-19 among children. So, it is a very helpful tool in all of our public health interventions to help get kids back to normal life. And I think that's one of the big priorities is, the last 2 years we've been robbed of so many normal events in school, in soccer, and in so many parts of our social life that I think are so important for development for kids. So I think it's a big motivator to want to get kids vaccinated and to make sure that they can participate in all the kind of events that they would normally do outside of this pandemic. So in clinical trials, the vaccine side effects were mild and similar to those seen in adults with other vaccines recommended for children. So the most common side effect was a sore arm, and I'll second that. And I'd say most of the time, sore arm is the main side effect. Some people who have had COVID before who get a booster or have an intercurrent illness might have a little bit more of fatigue or some feeling of low-grade fever. But I would say for the most part, kids tolerate it really, really well. New Yorkers 12 and older who have received their Pfizer second dose at least 5 months ago are eligible for the Pfizer booster. So that 3rd dose, that booster, is a really helpful tool as well. What happens with vaccines is that our immune system produces a lot of antibodies up front, and those antibodies do protect us for many months, but they can start to decline or wane over time. So I would say that the Omicron variant has especially been important lesson for this, that both with Delta, a variant we saw in summer, and Omicron, we did see some breakthrough infections in vaccinated people. Most of them did not require hospitalization, but they still showed that the booster doses can often really help prevent some of those breakthrough infections. Okay, so those are some of the main points on eligibility. We can pause here, Andrew, or move on to the next one about the frequently asked questions?
Yeah, we can start to go through the questions, and then
Okay.
if folks have other questions in addition to this, they can that are related specifically to vaccines in children. You can please put those in the chat. And Hector, you can help make sure everyone knows they can start to ask questions specifically related to vaccines for children right now.
Perfect. Okay, great. So yeah, are children at lower risk of getting sick from COVID-19? That's true. So the sickest of our patients have tended to be adults, especially older adults with other conditions like diabetes, obesity, and transplant, other things that lower their immune system and their ability to fight off this virus. So in general, I would say that's true. But we definitely have seen, with the Omicron, there was such an intense number of infections that the hospitalization rate for kids also went up. And it's unfortunate because I think, still a lot of those kids were not eligible yet for the vaccine, but some of them were in that age group where they could have been vaccinated. And we certainly want to prevent a hospital stay for any child. There are some specific syndromes among children that are particularly concerning. There's one called MIS-C. It's a multi-system inflammatory syndrome in children. And it tends to be fairly rare, fortunately, but when it happens, it can be very scary. It's essentially the immune system being triggered by this virus to cause inflammation in many organs. And it can happen after the child has already sort of recovered from the initial infection, but it can be lead to hospitalization, and it can be a very scary time for parents for the child as well. So while the overall pattern is that, yes, severe illness tends to occur more in older adults, we still do see children sometimes requiring hospitalization. So I think it's really a valid concern to want to get vaccinated for this virus. When you receive the vaccine, are you being infected with COVID-19? The answer is no. So the vaccine that is licensed for children is the Pfizer vaccine. It's an mRNA vaccine. So messenger, M stands for messenger RNA, means that this is basically some genetic material that has the information for the spike protein, the outer coat of this virus, and nothing else. So when our body's proteins see it, they make more of the spike protein inside of our cells, and our immune system recognizes it as foreign. So it starts targeting that spike protein, making lots of antibodies, so that when we encounter the real thing in the world, when we get, let's say, close to someone who has COVID-19, SARS-CoV-2, we already have those antibodies present, and they can bind the virus, preventing it from infecting a lot of our cells, hopefully preventing infection completely, so we never get any symptoms, we don't spread it to anyone. But even if we do get infected, hopefully we will have a milder version. So it's not injecting any kind of live virus. How bad are the side effects? I would say the side effects are mild. Again, the general pattern here has been that most people will get a bit of a sore arm. They will get maybe a day of fatigue in rare cases. But in general, most people tolerate this really well. I'll mention that there have been some more adverse effects, and this website here lists a lot of that. So in some of the other vaccines that are licensed in adults, specifically Johnson & Johnson, and in Europe, AstraZeneca, that was sort of a different model of vaccine. That was a live attenuated inactivated virus vector that was transmitting some material, again, for our body to produce spike protein. And in some of those patients, the side effect of concern was a blood clotting problem. So, fortunately, that was a very rare event. And, we have other vaccines that have kind of taken over as the recommended vaccines, in part because of those rare safety events, but also because of the efficacy of the mRNA vaccines, both Pfizer and Moderna in adults. So I would say those events are rare. You'll also once in a while hear about, with the mRNA vaccines, rare causes or rare events of something called myocarditis. So myocarditis is just an inflammation of the heart muscle that can lead to some problems with chest pain or shortness of breath in especially younger males who get this, the vaccine. It's again, another rare event. So millions and millions of doses of this have been given, and very few events of myocarditis have occurred. The patients who have had that have had a transient myocarditis, meaning it's not a long-lasting side effect, but it's one that we know about, so that we think about with our younger male population. But it's not something that I would say would get in the way of getting this vaccine, because the actual coronavirus infections in unvaccinated population tend to be so much worse. So,
Dr. Kaplivsky, there's one related question just to follow up on that from a parent. They asked, how effective is the vaccine on children who have asthma? And does it not affect children who are allergic to penicillin?
Okay, great question. So the first one is, how effective is the vaccine in children who have asthma? It's very effective, and equally effective as if they did not have asthma. Even if they're on inhaled steroids, or they're taking prednisone, for a short period of time because of an asthma exacerbation. I would say that they're especially recommended to get this because COVID vaccine prevents that respiratory syndrome that can be more severe in kids with underlying lung problems like asthma. So highly recommended there. And does it not affect children who are allergic to penicillin? So allergy to penicillin is not a problem. There's no penicillin in the vaccine. And people ask about other types of like food allergies and things like that. And in general, none of those are contraindications or problems with getting the vaccine. So I would say, in the early days of the vaccination process, we were having people wait 15 minutes, 20 minutes in the vaccine centers just to observe for any kind of side effects or allergy. But it's been so rare that it's really not been necessary. So you can get this at the pharmacy, and you don't really need to. It's very similar to a flu vaccine in that sense. It's FDA approved, and now we have a lot of experience with millions of doses, so we have less of those issues of allergy responses.
Great, thank you.
Yeah,
and I'll add to just for Hector, and he's answering the chat. If any of those questions do come in Spanish, and someone wants to make sure that they understand it better in Spanish, feel free to speak up. And Dr. Caplivsky, we're very fortunate also is a native Spanish speaker too, so he can share that in Spanish if need be.
Sure, yeah, I can talk a little bit about that en español también. Básicamente, la vacuna contra COVID en los niños es muy eficaz y tenemos mucha data ahora que no hay efectos secundarios importantes. Los efectos secundarios importantes que hemos visto son dolor en el brazo. A veces hay personas que van a sentir un poco de fiebre, un poco de cansancio, pero los efectos secundarios más severos no se han visto en los niños, y por eso tenemos mucha fe y confianza en estas vacunas para los niños. El otro punto que estaba diciendo es que básicamente COVID como enfermedad en los niños suele ser mucho más leve que en los adultos, eso sí es verdad. Pero como tenemos tantas infecciones ahora en Nueva York sobre todo, es importante vacunar a los niños, porque lo que hemos visto en diciembre, en enero, es que en los hospitales hemos visto más niños que se han hospitalizado por este COVID, y eso es debido a la gran cantidad de infecciones que hemos tenido. No es una versión más severa, pero como hay tantos niños que se están infectando, y algunos de ellos tienen algunos problemas para comenzar de antemano con los pulmones o otros problemas médicos, sí hemos visto más niños hospitalizados. O sea que es un buen motivo, un buen momento para vacunar a todo el mundo, los adultos, pero también a los niños, porque pueden protegerse de esta infección.
Great, thanks so much. Yeah, I think we have 2 more questions on this page, and then if others have any questions, they can add it in the chat, and we'll get to that.
Great. So,
yeah, so the next one says, I think it meant how is the vaccine dosage different for children and adults? And a follow-up is whether they should wait to get a higher dose if they're almost 12 or almost 18.
Yeah, that is a good question. I would say, there is a lower dose for kids under 12. It's weight based. Most of the kids are getting a third the dose of the adult dosing. I think that the peak of this current outbreak and wave is still with us. We're hopefully seeing the second side of that curve. We're starting to go down. But I would say this is probably the time in the winter when we're going to get the most benefit from getting the vaccine. So I wouldn't hesitate just based on the dosing. I think the immune system is able to produce plenty of antibodies, whether you're getting a third the dose because you're 11 and a half, or you get the full adult dose when you turn 12. So I would just recommend getting it now because we're sort of in the peak of the season of the current Omicron wave. Hopefully we're getting past the worst of this, and we're going to talk about that, the future of this pandemic as well. But I'm hopeful that we're moving past it. But I do think this is probably the moment when you're going to get the most benefit from getting the vaccine.
Great, thanks. So I think before we move on to boosters, just quick overview for everyone that has not yet gotten their vaccine. How do they go about it? Where do they get that shot? Dr. Kaplivsky, anything you want to add here that's on the screen?
Yeah, I think for parents, it's been, so tough these last couple of years, and there's been so many things that have been hard to find, and I think, for everybody who went through December and a lot of January, trying to find tests for your kids was the real, the lines were so long at urgent care centers and testing sites. And, that was a huge struggle for a lot of people. Early on in the course of the pandemic in, 2020, I remember, also finding we were just so eager to get the vaccine, and especially as healthcare workers. And so when somebody called you and said, okay, it's your turn, you dropped everything, you went running to get it. I think we're at the point in the pandemic where we're really fortunate to have such great access to vaccines. I think if you try these websites, you're going to find that there are many pharmacies that have it available in their, you can get it at the pharmacy. It's by appointment, you can book. There are some, sort of larger vaccine sites like the Museum of Natural History. For some of the kids, that's kind of fun to get it over there by the Blue Whale. More and more pediatricians are getting access to the vaccine in their offices. But yeah, the New York City Vaccine Finder website is excellent, and I think there's a lot of availability now. So hopefully people will take advantage of that, and so they get their kids vaccinated.
Perfect, thank you. Is there any other questions on? We can always come back to it at the end too if it does come up. If there are any other questions on vaccines with children, please put it in the chat now. Otherwise, I think, Danielle, we can move on to the next slide. Great, so we're going to move on to talk a little about the boosters and what that means. So I'll turn it back over to Dr. Kaplivsky.
Yeah, so vaccine booster shots are now authorized for everyone 12 and older who is fully vaccinated. And I think depending on the timing of, when your child or you yourself got the vaccine doses, it can be very helpful to get those boosters. I think that, as I was mentioning, there's this normal process where your body makes a lot of antibodies when it initially finds or encounters a vaccine protein. And then there's a natural decline over time. And with this particular variant, with Omicron, we've noticed that, having the booster was really helpful for preventing that severe illness, for preventing some of those breakthrough infections that we've also seen. So yeah, those are the first couple of points. Booster shots of the Pfizer, BioNTech, and Moderna vaccines decrease the risk of infection and hospitalization. They're 90% effective at decreasing hospitalization due to Omicron as well. So, and that's one of the things that we were really, I think, surprised by, just how quickly Omicron was going to move. I think when we looked at the initial cases that were described in South Africa, it was it was a foreshadowing of what we were going to see here in New York and the country at large. But basically, the epidemiologic curve, which in some diseases, it's just kind of a slow upward slope. It was almost straight up. It was just such a rapidly spreading variant. And that has to do, again, with the way that viruses change over time as they've been, circulating the globe. There's some selection pressures so that the viruses that are most effective at infecting people are going to be the ones that survive. And the mutations that occurred just made this particular variant very sticky with our receptor cells. So that made it more likely to infect people, even those who had been vaccinated. But certainly those who are unvaccinated, we've had a harder time controlling this particular virus because it's been so quick to spread and so effective at infecting cells. Even if you get COVID-19 infection, you should still get your vaccine booster once it's safe to do so. So that's a very good point to think about. A lot of people got their first 2 doses. They got a breakthrough Omicron dose or a breakthrough Omicron case. And we're still recommending to get that booster dose. And in part, that's because we're not sure what's around the corner. I think there's a lot of hope out there that we will see enough sort of general population immunity that that the pandemic will be, coming to an end. But I think the reality is that more likely we're going to see coronaviruses in circulation as, sort of like our seasonal influenza. There are other coronaviruses that we deal with all the time. The regular cold viruses are coronaviruses many times. And most of those don't come with this severe syndrome that we see in some people, leading to hospitalization. But I think it's very difficult for us to predict what's going to happen over the next 6 to 12 months. So we would definitely recommend getting that additional dose of the booster.
Great. I think that's the majority of the section on boosters. So I want to open up quickly in case there's any questions on boosters, or Dr. Kaplivsky, if there's anything additional you want to add in that respect. But if anyone has questions regarding the booster, you can share it now, or we'll come back to the Q&A.
Yeah, I'll just mention, I think, 2 doses are still very likely to protect you from hospitalization and death. I think, the part of the motivation of that booster is to hopefully protect those around you. And especially in school settings, when we've been trying to get everyone back together, normal in-person learning, the more kids that have that full 3-dose series, the less likely we are to see, bigger outbreaks that can lead to classroom shutdowns or shutdown events that were planned before. So I think that's another reason to want to, just get everyone the maximal protection.
There's one question, and this will get into kind of the next section, so it'll help us transition. But are you aware whether boosters will become a requirement, just like a full vaccination is currently required to get into most spots?
Yeah, I've participated in some discussions, so I'm not aware of any final decision, and I feel like it's very dependent on each individual organization. So, I've heard some conversations and discussions among school groups, because that's one of the settings where you would really want to have some consensus, and there's really not a lot of consensus, because I think there is some feeling that maybe 2 doses are enough to prevent hospitalization and death. And maybe if we're already getting to high levels of vaccination among our school population, at least with 2 doses, maybe that's going to be adequate. I think there's another school of thought that, as I mentioned, if you get that 3rd dose and you really have a very protected population, you have a better chance of keeping your school open through really tough seasons like we just went through with Omicron. My sense is that a lot of organizations like schools are, looking for guidance from the New York City and New York State health departments. And I think that, a lot of, that sort of decision-making is going to depend on what the next couple of months bring in terms of cases. So, we are definitely seeing a fall off in number of cases compared to December. It's a very encouraging trend. Our hospitalization rate remains high, because there's a lag between the time people get infected into the time when they get hospitalized. But there is some decline in our hospitalization rate. It's tragically across the country, there's a very significant death rate of over 2,000 people dying of this every day. Again, most of those are among adults, but if we control the pandemic among kids and older children, then we have a better chance of protecting some of those older adults who either haven't been vaccinated or can't get a good immune response to the vaccine. So there's a lot of nuance to that decision. And I feel that most of the big organizations, like in our school system, both public schools and independent schools, are looking to the city and state to come up with some answers and decisions about that booster.
Great, thank you. I think we can go on to the next section. And I think in the next session, what we'll do is maybe I'll read the bullets, and then you can feel free to provide commentary. I might add additional question. And so in terms of current COVID-19 restrictions, we just wanted to go through this, and then we'll add a little commentary as well as what's going on at South Bronx United, and invite any families or parents to add on additional questions if they have questions regarding that. And Hector, feel free to put that in the chat in Spanish if people have additional questions around our requirements. Those won't show up on the screen, but we can speak to that too. But as the biggest thing is, as of December 27th, most New York City workers need to show proof that they're vaccinated. So with it, and I could say within South Bronx United, for example, all of our staff, all of our volunteer tutors, everyone that's in the building with them, all the coaches, they are all indeed vaccinated.
Yeah, I think it's a big help. Early on, there was a mandate for healthcare workers, and I think, as I said, there was a big group of us who were just waiting till we got that call so we could get our vaccines, because we had seen so many people get this infection and taking care of them, and it was scary. So I think all of us were very motivated, who were on the front lines, but not everyone. I think there was some vaccine hesitancy among healthcare workers, and it was really tough. And I understand that. I think anything new is going to come with some uncertainty and a feeling like, what am I signing up for when I get this vaccine? So that's totally understandable. I think the vaccine mandate eventually among healthcare workers overall worked. I think most people eventually came around and decided to get it. There were some people who said, no, I'm just not going to do this. And they left the job and they're doing something else. And we feel bad because we lost team members, that didn't want to do this. So but I understand the hesitancy because it's a very new vaccine. But we are definitely getting more and more experience with it. We're getting more data, and I think we're also taking the perspective that we're in a really privileged position in the United States, that we have access to several great vaccines. We have access to them for free. It's a real privilege that I think, if you think about in many other parts of the world, that's not the case. A lot of countries are not going to have that same level of access to these really high level efficacy vaccines. So the other side of this, I think, is to think about just how do we get back to normal? Like, how do we get past this pandemic? And I feel that, in some ways, this is one of our big important steps. The more people that we have immune, the more chances we have of really decreasing the number of cases, and allowing for us to start getting back to the things that we all love to do. So I think that that's hopefully a motivating point for people as well when they think about that vaccine.
Great, thank you. We can go to the next slide, and I think the first two bullets have a question for you. So first says masks are required in all public indoor and crowded outdoor settings. And with the exclamation point, wear a well-fitting mask. I've heard a lot about this, especially through Omicron. KN95, KN95, KN94s, I believe, provide the best protection, followed by surgical masks, and then cloth masks actually provide the least protection. So as a doctor yourself, what is your recommendation in terms of masking?
Yeah, I agree. I think you find the well-fitting mask that you can tolerate. And I say tolerate because, at work, when we are seeing patients right now in the hospital, we're wearing and real sort of hospital grade N95s. And we're doing it for hours at a time. And I really, I sympathize with anybody who has trouble with this because, it really puts a lot of pressure on your nasal sinuses. It's really, can be really uncomfortable if you're wearing these for hours at a time. So the hospital grade ones are sort of ones that we've been fitted for. We're tested to see if we're like a regular or a small, and that's very formal testing with, making sure we're not smelling any inhaled aerosols when we're in a hood. So that's sort of the hospital grade. The KN95s and KN94 and 94s, I think, are a lot more comfortable and a lot more tolerable. And they certainly do provide more protection because they've got a better seal around the face. Some people to try to use a scenario where they've got a regular surgical mask and then they put some sort of a cloth around it to try to give additional seal around the face. And I think this has evolved over the last couple of years because, as you remember, a lot of us in public health were saying, especially in the early days, let's save all those N95 masks for the healthcare workers. There's a shortage, there was a big problem with that. But now there's plenty of them out there. And, for certain scenarios where you're going to be indoors for a prolonged period of time in a very crowded place, that higher grade mask is especially important, and sometimes that's, people ask me a lot about airline travel and airports. And, I think those are scenarios where that can be especially helpful. In classrooms and, in scenarios where kids are together in indoor settings, I think the higher grade masks are very helpful. I think whatever they can tolerate, though, is probably the best, because it's hard to stay in an N95 for very prolonged periods of time.
Yeah, thanks. I know at least one of my kids very happy with the cloth mask. He's so used to it, he'll wear it all the time, but he won't put on a K95. And I think, like you said, it's just about what's most fitting and comfortable, and we'll get them to keep it on their face inside.
Mm-hmm. Yeah.
I'm going to skip the next bullet because we touched on that already. But on the last bullet, so this is a change that came pretty recently. If you have COVID-19, isolate at home for at least 5 days. After 5 days, most people can leave their home if they do not have symptoms or their symptoms are improving and they have not had a fever in the last 24 hours. They must wear a well-fitting mask around other people for 6 to 10 days. So that's a change from previously saying 10 days. It's been cut back to 5 days. I'll add also at South Bronx United, we're asking folks to return a negative test before they return after 5 days, but I understand that's not the CDC recommendation. So maybe you can speak to that change a little bit.
Yeah, I think, it's certainly hard to keep up because all this was happening very quickly over the course of December and January. And even if we go back to like the early days of COVID in 2020, it was this 14-day period, and then they kind of shortened it to 10, and then down to 5. And where does that come from? So some of that is based on the science of the virus, and as it's evolved, we've seen that the vast majority of replicating virus, meaning virus that's copying itself and when the time when you are actually most contagious, is early on in the course of the infection. Unfortunately, some of it happens before people are symptomatic, and so that's one of the issues that comes up is, can you infect someone if you're not having symptoms yet? You can, and that gets into why a lot of people who have been exposed to COVID-19 are recommended to go quarantine for a period of time, and just make sure that they're not going to spread it further to, let's say, classmates. But the period of time when you're most contagious really has shortened, and I think it's the changing nature of the virus. The virus has produced earlier symptoms as well. I think that, when we saw the early days of COVID-19, there was sometimes a lag between exposure and times when people really started developing those symptoms, but that period has shortened as this virus has changed. I think the other factor that was going on in December was that you had such a huge impact on the workforce, including the hospital workforce, that there was a lot of pressure to get people back to work, as quickly as they could, including the airline industry and a lot of other industries where, there was just huge effects when lots of people either were getting Omicron or exposed to it. So I think that's how a lot of that evolved. I think the testing question is a great one. I think that, there are several different types of tests. One is the PCR, and a PCR is looking for the genetic material of the virus most of the time in your nose. In the past, we would go all the way back to the nasopharyngeal space, which is really far deep. Now it's most of the time in the anterior nares, or the sort of front part of your nose. In some places, they're also looking for it in the back of the throat, with an oral swab. And all of these are techniques, based on trying to maximize the recovery of the genetic material of the virus or the proteins of the virus without causing as much, sort of trauma just by going back in the back of the throat. So the different types of tests include PCR, which is very helpful because the PCR tends to be very definitive. If you have a positive test, it's very likely that you have at some point been infected with the virus. And it's pretty sensitive, meaning we can catch this, the likelihood that you're going to be positive if you are infected is very high. The downside of the PCR is that once you do have a positive PCR, sometimes you can be positive for a really long time, even after you're no longer contagious, no longer going to infect anyone else. And that's because there could be dead virus that's still present in the anterior nares. You've got cells in there that are breaking down those old genetic material sequences, and that we can still find for sometimes even weeks after you've been recovered. So the other test that's available is the rapid antigen test, and those are the ones that you'll find at pharmacies that the government is mailing out to households. And those, many of you have experience with. You've done those probably on yourself, and those are very useful because they, obviously you don't have to go to a healthcare facility to try to get one done, and they can be a little bit more informative in terms of whether or not you are still contagious. There's a little bit of downfalls. I mean, early on in the course of the infection, we've certainly seen people that have a negative antigen test, and then 2 or 3 days later, they'll be positive on the antigen test or a PCR, and that's just related to the sensitivity of this test, meaning you have to have a lot of virus present for this test to be positive. So sometimes you're too early to really detect that, and it's a bit of a downside. There's the chance that you may have some people who are still positive on the antigen test, even beyond 5 days, that may no longer be contagious, but that can be hard to tell. It's certainly reassuring if you've had COVID and then you get a negative antigen test before returning to a sport. So, I think a lot of that can be helpful for peace of mind and, just trying to keep the team intact and prevent, further spread, especially with Omicron that has been so contagious.
Great. Yeah, thanks. I think the testing is a really big thing. I think that transitions into the next 2 slides. I'll read through the bullets on the next slide, and then after that, you can go to the following one because that'll be in Spanish. But so this is more about quarantine. So there's obviously a lot of Omicron that's going around a lot. Everyone felt like it was a close contact. Everyone knew someone that had it. And the quarantine rules, as we understand it, is if you come into close contact with someone, you not need a quarantine. If you're for those that are 5 to 11, if they've completed the primary series of vaccines, if they're 12 or older, if they've received all recommended vaccine doses, and it's suggested the booster when eligible as well. And then if you had COVID-19 in the last 90 days, that's according to the New York State website. But you should quarantine for the 10 days if you are not fully vaccinated or have not received the recommended booster shot, or received a single dose Johnson & Johnson over 2 months ago and not received a booster. So that's also changed, and I think questions as well around quarantine needs in time of Omicron as well. So curious on your thoughts on that.
Yeah, this all gets into immunity. So what we're trying to say here is if you are likely immune to this virus, then this quarantine period is not applicable. The people that are most likely to be infected by the virus after an exposure are those that are going to have either not been eligible for the vaccine or not gotten it. There is still obviously the chance that you could get breakthrough infection if you've been vaccinated, but that's a lot lower risk than if you were someone who had not been vaccinated or who hadn't had a recent infection. And the 90-day period with prior infection is trying to get at the idea that you are most likely to have protective antibodies for around 90 days after a recent infection. If you had, let's say, COVID early in the course of 2020 with one of the earlier variants, and then now you're exposed again, but you haven't been vaccinated, you're still just as likely to get the infection as someone who's never been infected. So the natural immunity we were hoping for with earlier variants has not really held up in the unvaccinated population. People who had the infection then got a vaccine series do have excellent antibodies. They do have really good protection. So that's part of the rationale for wanting to get everybody vaccinated, even if you've had a version of COVID in the past.
Great, yeah, thanks for that. And I should point out for all the parents, I know I've had this with my own kid, even if your child is vaccinated, if they're deemed a close contact, schools are now distributing home tests for everyone. So you should be receiving an at-home test from your school if your child's a close contact, and they should be sending home a paper that tells you to when to take that test, if it's immediately, and then a second one 3 to 5 days later. I know I've got that. I think all 3 of my kids have had that already at some point. We've received some at home.
Yeah, a lot of the test to return strategies, have been employed to try to get kids back to school as quickly as possible because, we're certainly at the point of the pandemic where, some of the downsides of quarantine and closing schools are starting to really outweigh the benefits of, keeping other kids safe and keeping, parents safe because I do, and I've heard this from other pediatricians that it does feel like there's a shift from the early days of when this was a new virus, we didn't have any vaccines available, we didn't have any real proven treatments, to now when we do have these vaccines available, we're getting closer to a variant that tends to be milder in kids. So, if we do get a lot of kids vaccinated, hopefully we'll have so many fewer disruptions to school.
Great. Well, thanks for those explanations. If anyone has questions around the guidelines in the city, state, even at South Bronx United or in your school, please put those in the chat and let us know. And I think the next section we'll move on to is some questions around what's coming next. What's the future of COVID-19 look like? So I'll turn that back over to you, Dr. Kaplivsky, to read through some of those questions.
Yeah, we'll go to the next slide. And maybe slide 15. Okay, so let's go through the first. How long will COVID-19 be around? Well, I wish that this was the last variant. I wish this was really the last time we were going to deal with this particular coronavirus problem. But I suspect that, we're going to be dealing with coronavirus on a more seasonal basis, and it will become part of what we call the cold and flu viruses. And as a point of reference, in 2009, we had a new influenza virus, and that was called the swine flu. So the H1N1 version of influenza was a novel influenza at the time. And, it was one that we didn't have immunity to yet. We didn't have vaccines to yet. And it really quickly spread throughout the globe. So that was a pandemic strain of influenza. It was a mixture of pig virus with bird virus and human virus that recombined and then, happened to be very contagious. And the good news is that, that was a relatively mild strain of flu. And it just became part of our circulating seasonal influenza. So nowadays, when you are getting your influenza vaccine, your seasonal flu shot, what you're getting is a mix of a couple different virus proteins, among which H1N1 2009 strain is one of the main ones. So that's one thing to put it in perspective. How long is the 2009 pandemic going to last? Well, it transitioned to becoming endemic. It became a virus that was just part of our circulating viruses, but that was no longer causing the major societal disruption that we saw early in the course of 2009 when it first came out. So I think the likely scenario is that COVID-19 will be with us as a seasonal virus, especially in colder climates when it seems to be transmitted at higher frequency. And we may still see, some summer waves of this as well. But hopefully with the heavily vaccinated population, it will be a lot less disruptive and will have a much lesser impact on our daily lives.
And thanks. And before we go to the next, that are very much related, I'm sure, to the same question, but I know this question came in Spanish as well. So do you mind kind of giving a little overview in case there's anyone that wanted to hear that directly from you in Spanish too?
Yeah, ¿cuánto tiempo va a durar esta situación con COVID? Para mí, yo creo que vamos a estar viviendo con COVID por el futuro, pero vamos a vivir con una versión mucho más leve y de una versión que se va a caracterizar como una versión del gripe o un catarro normal que tenemos, que todo el mundo pasa por ese tipo de infección. Yo creo que las vacunas son muy importantes en ese sentido porque eso previene la versión más severa que nos puede traer al hospital o puede causar la muerte. Y yo creo que una analogía es la versión de influenza que tuvimos en 2009. En 2009 encontramos que había una influenza, un virus nuevo que surgió de una mezcla de viruses de los puercos, de los aves y de los virus de humanos. Y en 2009 comenzó en México y de ahí salió básicamente a todo el mundo. O sea, todo el mundo que ahora se infecta por influenza, casi todas las versiones que hemos visto son por ese estirpe de 2009. O sea que ahora lo que tenemos en esa pandemia es una situación en que las vacunas que usamos contra la influenza son vacunas que incluyen las proteínas contra la versión de influenza de 2009. Y estamos no en una situación de pandemia, sino es una versión epidémica y endémica del virus. O sea que es una versión que todo el mundo se expone, esperando que nos hemos vacunado, va a ser una versión más leve o nos va a proteger la vacuna y no tiene el mismo impacto sobre la sociedad que antes tenía. Si uno acuerda que en 2009 había restricciones del viaje para los viajeros viniendo de México y problemas para escuelas y problemas para los viajeros. Entonces, esa situación ha transformado a una situación endémica y yo creo que hay algo parecido con COVID-19, que ya estamos llegando a un momento que vamos a estar viviendo con el virus, pero que no va a tener el mismo impacto en sociedad que ha tenido en estos 2 años con las vacunas y poco a poco yo creo que vamos a llegar a un momento que las mascarillas no van a ser necesarias, pero yo creo que todavía en la gran mayoría de los casos no estamos en esa situación. Es decir, en situaciones como en los colegios, en los hospitales, y yo creo que todavía no estamos en el momento de sacar las mascarillas, pero yo creo que ese momento sí va a llegar y que vamos a ver un porcentaje de la población que se va a vacunar y vamos a tener más inmunidad y eso nos va a ayudar a transformar esta situación en una situación mucho mejor y mucho más normal.
Thanks so much. And yeah, maybe can you touch on the next few bullets there?
Yeah. So the next couple bullets have to do with masking. So how long will we have to keep masking? And how long will isolation and quarantine rules be in place? So on the masking question, I was starting to talk about this a bit in Spanish, and I think we are getting there. Certainly, I think that the Omicron variant has really gone quickly throughout the New York City area, and I think that there are more and more people who are getting some sort of immunity, either from a combination of vaccines plus natural infection or natural infection. And I think that, some scenarios will take longer, certainly hospitals where we have a lot of people who are immunocompromised and, at risk for higher complications from COVID-19 are places where you're going to see masks on for a longer period of time. School settings might be a place where, maybe that would be one of the first places we could start to see, taking off the masks, just because, again, in general, kids tend to have milder versions of the illness. I think there's a lot to be said for the social importance of schools and, being able to interact with teachers and friends without masks. So I would imagine that, that would be one of the scenarios where we would see it early on. In terms of the timing of that, I think it's hard to note. I think, spring, I think the big goal for all the schools are to try to keep, in person and open and not need to close at all. So there's some motivation for them to want to keep the masks on, just to limit the potential for school closures. But if our overall community infection rate starts to really go down after this Omicron surge, there is a possibility that they might start to back off on the masking requirements. Certainly for outdoor activities, I feel like are a scenario where, the risk of transmission is much lower than if we're in the crowded indoor spaces. So, that's my hope, is that, as we move forward, especially for the kids who are generally healthy, we're going to be able to see less masking. In terms of isolation and quarantine rules, again, this has to do mainly with societal disruption and the desire to keep things open, especially school classrooms. And I think the nature of Omicron is that it is, very contagious, and it's fortunately a milder version of COVID-19 than we saw with Delta or the prior versions of COVID. But it is very disruptive, and it's very contagious. And I think that makes it a hard decision for a lot of people who are in charge of a school or, a soccer team or, a group of people that want to be together and do things, but don't want to have, a large group of people absent because of infection. So I think, we're stuck with them for a little bit longer at the current community infection rate, which is very high. But I do think that that's going to be coming down, and I'm hopeful that as we get into spring and summer, those kind of things won't be necessary, and that we will get into a more endemic phase of the coronavirus story, so that it becomes a little bit more like a cold or a flu. And will we have to get more booster shots? We might, yeah. I think that the question is, what's next in terms of variants? Are we going to see another Greek letter coming after Omicron that potentially could have, more implications for society at large and individuals? And I think that my sense is that we will probably see something on an annual basis, most likely, just similar to what we're seeing with influenza. And some of that may just be, the desire to keep the overall levels of immunity, especially among, again, school kids, where we want to keep schools open, keep those levels high so that we don't have the disruptions that we've seen over the last couple of years. But in terms of the severity of the virus, I mean, it's certainly good news that Omicron has in general been a less severe version of infection. we still have, people unfortunately who are getting hospitalized and people who are dying. And, I think, a lot of those are among people who have not been vaccinated. And, there's some people who just don't make a good vaccine response because they've had, let's say, a kidney transplant. But we certainly have a lot of opportunity to prevent that. And, I'm hopeful that if we are going to see future variants, they're not going to gain function in terms of severity of illness. Sometimes we're seeing mutations that do cause more contagiousness, but hopefully we're not going to see versions of this that, produce more inflammation, as the virus changes over time.
Thank you. Yeah, that's so helpful, and I think we all hope that if there's a pie, right? Pie's next. If there's a pie, then it'll be
Right.
even less severe than Omicron. That's super helpful. I think we have just one more slide for information for everyone watching. Hopefully everyone has seen that you can get your 4 free at-home COVID tests now from that website there, and maybe put that link in the chat as well. But make sure, if you have not already, to go there, put your information in so that you can get mailed 4 at-home take-home tests for free. I think one other thing on this as well that folks should know is insurance is now required to reimburse, correct? At-home tests as well. So I think folks will have to, if they're insured, check with their insurers to figure out how to get those reimbursements.
Yeah. And I think we're at a point where the scarcity of testing has been alleviated to some degree. I think everybody went through a period where you just couldn't find any tests on the shelves. But I think that this, the availability of tests is helping, to figure out ways of preventing spread and hopefully to keep schools open and get kids back to class, with test to return strategies as well.
Great. Great. Well, I think this has all been super helpful. We can open up in case there's any last questions that haven't already been addressed. If anyone does have any, you could even unmute yourself, I think, or just put in the chat if there are any. We'll give a couple minutes in case anyone has any last questions. And while people are putting in, there was one question that I think mostly was addressed earlier in the vaccine section, but it was around why is it how did we get the vaccine so quick? It seems like and I think we addressed this a year ago as well. But for any other folks still hesitant out there and wondering how do we get this so fast? I know there's a whole article in the New York Times recently about it, but what would you say to that if someone was still unsure about the vaccines and said, well, there's no vaccine for HIV, but after 30 years of trying, but we already had a COVID-19 vaccine?
No, I think it's a great point. I wish we had an HIV vaccine, because I see people with HIV every day, and we treat them with medicines that they have to take a pill every day, and it's much better. We're able to keep folks healthy, but we would love to have an HIV vaccine. And I think the answer that I boiled it down to last year was money, and I think that's to some degree still true, in the sense that there was a lot of money behind these vaccines to get them through the approval process. And they did go through the normal approval process that all of our vaccines that are licensed in the United States go through. The difference was the speed at which it was happening, because basically, pharmaceutical companies, when they're looking at infectious diseases, they have a lot of money to lose if a vaccine doesn't work, basically, because it really is hundreds of millions of dollars of research and clinical trials and approval process that may not work out. There are certainly a few vaccines that were sounding really promising, and then they just didn't have the efficacy that we would like. They didn't really protect it to the degree we wanted to. So with the COVID vaccines, you had governments that were really motivated to get something out quickly and make sure that it was going to work and that was safe. but that the process could be as quickly completed as quickly as possible. So, some of the steps that allowed them to do that was that, while they were going through some of the early sort of phase 1 clinical trials looking at basic safety, they were already starting to enroll for the next phase of the trials looking at efficacy, because we were in the midst of the pandemic. There were a lot of people getting infected. So you had a lot of people who were eligible candidates who could be signing up, for these clinical trials. And I think that was the big difference is that there was such a strong motivation to get this done globally, that they were able to complete all the normal regulatory steps, but in a very short period of time. And HIV virus is tricky. It's one of these that a lot of my colleagues are working on vaccine strategies for HIV, and it's a virus that tends to hide inside of cells and become latent or sleeping, and that makes it a real challenge to get effective immunity, because some of the virus that it's not out there copying itself and replicating and causing trouble, but it's kind of like sleeping inside of dormant T cells. And that just makes it a real challenge to get to every last, protect effectively against that virus. Similarly, the idea about a HIV cure using maybe the immune system or a vaccine, that's one of the major challenges, getting to all those latent cells. And it's a virus that infects our immune system, which is another challenge with it. It's trying to protect against something that attacks the very cells that are there to protect us. So HIV vaccine is a real big prize that we would love to have one day, but we're very fortunate to have several different COVID vaccines to choose from.
Yeah, amazing work from the scientific community, and then hopefully eventually you can get there with HIV as well. But I think that's a great place to end on. That once more encouraging everyone, if you haven't gotten your vaccines, your children haven't gotten your vaccines or your boosters, to do so. It's never too late, and we've gone through a whole range of reasons why and how it can help moving forward. So I think on that note, if there looks like there's no other questions, so I think it's a great place. I want to thank you so much, Dr. Kaplivsky, for coming on again, join South Bronx United year 2. Hopefully we can come back next year with a whole nother topic, maybe unrelated to COVID one time.
I hope we're talking about Champions League or something.
Yeah,
like
we'll do a community resource forum all on soccer and
I want to hear
in that area.
All the kids are going to college, no, it's my pleasure to be with you guys, and great work in SBU for all the players and families that are benefiting from it. And it's a great organization.
Well, thank you so much. And thanks once again for joining us. And thank you everyone that's been tuning in on this session and watching online. We appreciate you taking the time. If there are any further questions on this, please do reach out to South Bronx United, reach out to us. We can get in touch with Dr. Kaplivsky to get an answer for you if you didn't get your questions answered. And we can also address any additional questions that do come up. So please reach out. Once again, thank you everyone for joining us tonight, and have a great rest of your evening.